Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are going to talk about test tube baby or IVF. So the moment we speak or listen the word IVF or test tube baby, everybody's ear get alert, everybody has little skip of heartbeat and palpitation increases, thinking, oh my god, it is a very cumbersome technique. But IVF is not a rocket science, it is very simple. What fallopian tube does in our body, when the same procedure we do it outside the fallopian tube in a test tube is called as test tube baby or IVF. What do I mean by that? So naturally what happens, a egg is released from our ovary and fallopian tube catches and takes that oocyte inside the fallopian tube. During this time, if you are together with your husband, semen gets deposited in the vagina and from there sperm has to travel through the uterus into the fallopian tube, and if one sperm is able to fertilize the oocyte, a first day embryo is born. From day 1 of the embryo till 5 days, embryo keeps on growing and moving in the fallopian tube. If the 5-day embryo is well formed, then this embryo gets transferred to the uterus and it looks for implantation, and if it gets implanted, the pregnancy journey starts, that is your pregnancy test comes positive. This is how a natural pregnancy happens. So what is different between IVF and a natural cycle? Difference between IVF and a natural cycle is, in natural cycle only single egg is formed, but when we are trying to do a IVF, we try to form at least 10 to 15 egg, which is called as controlled ovulation stimulation. So for this stimulation, we give the same follicular stimulating hormone which is released from your pituitary to form one egg, but I want more eggs, so I give it a little higher dose so that we can retrieve more number of eggs. These injections has to be taken from day 2 of your cycle for almost 9 to 10 days. Once the follicular size reaches 18 to 20 mm, that is the time when we give a trigger injection. A trigger injection is given for the maturation of the eggs. Once this trigger injection is given, exactly 34 to 36 hours post trigger, before the oocyte ruptures, we post the patient for the next procedure, which is called as ovum pickup or oocyte pickup. Ovum pickup is a technique which is done under anesthesia, and it is not a major surgery. There is no cut given to the women. It is just that through transvaginal ultrasound guided method, we put a small needle inside the vaginal fornix and aspirate the follicular fluid from all these eggs or follicles. Once this fluid is aspirated, it is being given to the embryologist, and embryologist starts screening and take out all the eggs which are there in that fluid. After the eggs are retrieved, they will grade it and they will check how many eggs are mature. Once we get this mature eggs, we collect husband's sperms and they are being processed and good motile sperms are selected. In a conventional IVF method technique, we take a dish in which one oocyte is left with some amount of sperms, and we let it fertilize on its own in an incubator which has an environment exactly like a fallopian tube. Like it has oxygen percentage, it has carbon dioxide in little amount, it has moisture, exactly how it is inside our fallopian tube in our body. So in this incubator, we keep this to grow for 3 or 5 days. Once the embryos are grown, then they are frozen, or if you are considering a fresh transfer, in the same cycle, the patient is given progesterone injections. Depending on the day of embryo transfer, it is given for 4 days or 5 days. If it is a day 3 transfer, a 4th day of your pickup will be your embryo transfer. If it is a 5-day embryo transfer, 6-day post pickup will be your fresh embryo transfer. But majority of the times we do only frozen embryo transfers, as the success rate of frozen embryo transfer is better. So after the pickup, patient is sent home. After 5 days we form the embryos, or 3 days we form the embryos and we freeze it. Then patient comes back again after her menses, and then we prepare the uterus according to the day of the embryo and we plan for an embryo transfer. These collected embryos are frozen in a vial which is called as freezing vial. On the day of transfer, these embryos are thawed, brought to the normal room incubated temperatures and then patient is posted for embryo transfer under ultrasound guidance. No anesthesia is needed, but under all aseptic precautions, embryo is transferred transvaginally through a catheter into the uterine cavity. This is how IVF technique is done. So what is the similarity between fallopian tube and IVF pregnancy? In fallopian tube, egg comes, sperm comes, it gets fertilized, grow for 5 days, and it is sent into the uterine cavity. Same way when we do a IVF, egg comes, we retrieve the egg through the transvaginal route. So we get the egg, we select the sperms from the semen, and we put one sperm inside one egg. And then we create an environment like a fallopian tube into the incubator, pack all the nutrition needed for the growth of the embryo, and this dish is or test tube is kept inside the incubator for 3 to 5 days depending on which day of embryo we want. But ideally, when embryo grows till 5 days in the fallopian tube, same way we leave this embryo to grow for 5 days in our incubator. After 5 days, tube will send this embryo into the uterine cavity. Same way, after 5 days, we take this embryo in our tube and we put these embryos into the uterine cavity, similarly as how fallopian tube does. So what tube does in our body, same thing when we do in a test tube outside your body, is called as test tube baby or IVF pregnancy.